Welcome back. In this video, we are going to study about a homeopathic remedy called Rheum. Introduction. Rheum is a everyday rhubarb which grows plentifully in China. Hahnemann did a proving on Rheum and confirmed its traditional uses to us. This medicine has been prepared from the powdered roots of the Rheum. Let us start with the guiding symptoms of Rheum and then move on to the particulars. Rheum is suited to children, especially during the dentition period. Sore smell of the whole body. You see that the baby, even after giving a nice shower and a bath, the baby still smells very sore. You're giving a nice bath, yet a smelly baby. You don't feel like carrying that baby or kissing that baby. It's kind of very sore smell from the baby. You also observe the sore smell in hepar self babies and macaque. Profuse and constant sweat is seen on the scalp, whether the baby is asleep or he is awake. Even if it is quiet or in motion, there is profuse sweat which is seen on the scalp. The hair, you always see it is gonna be wet, may or may not be sore. The sweat may or may not be sore. We have calcarea and sanicula. Okay, so guys, you see about the sweat here. It is seen on the scalp, which is profuse, and it may or may not be sore smelling. Cold sweat is also seen on the face, especially about the mouth and also the nose. The child is very restless. He is irritable, peevish, with pale face and sore smell during difficult dentition. So we have the other remedy, that is calcarea with the sour smell. Okay. There is a sour smell which is usually seen. This remedy is given during dentition and there is sour smell is what you have to remember. Moving on. So we know the nature of the baby. It is very irritable, restless, peevish baby. The baby desires for the various kinds of food, but they cannot eat them, becomes repugnant. So you see that they want this food and that food, the child or the baby, or the like 0 to 14 years you can consider. Usually Rheum is indicated in children during dentition and also in the babies. So here we see that the child is desiring for various kinds of food. Mama, I want this, that and everything, and then suddenly he becomes repugnant. He cannot eat them at all. It becomes very distasteful to them. It is very unacceptable. Okay, it is very disgusting taste he gets after the desire. He cannot eat them. Moving on to the rectum complaints. Before stool, there is unsuccessful urging to urinate. So you can see here, before passing stools, they have an unsuccessful urging to urinate. They feel like urinating, but the urge becomes unsuccessful, and this is seen before the stools. The stools will smell sour. So we saw that the baby smells sour even after shower, and then the stools are also sour smelling. The sweat may or may not be sour smelling. There is shivering and tenesmus. Burning in anus is also observed. Sour diarrhea again, and it is usually during dentition. As we have seen, dentition is very important. All the complaints are seen during dentition. So guys, what did we learn in the rectal complaints? There is unsuccessful urging to urination before stool. Stools can be sour, pasty, with shivering and tenesmus. Burning is also observed, and sour diarrhea. Moving on to the next complaint, that is colic. The colicky pain will be aggravated while they are uncovering an arm or a leg, and also colicky pain on standing. So guys, you have to remember this picture. Colicky pain on standing is seen in Rheum. Okay, and also when they uncover an arm or uncover a part of the leg, okay, or a leg. So we see the colicky pain is not better by stools. It is not better. And the colic is also associated with sour stools. How are the stools? They are sour. So there's a question. How are the stools in Rheum? They are sour stools. The children cry and they toss about the all night. We also see this similar complaint, a similar symptom in Sorinum baby. Okay, ailments are from eating the unripe fruits and also during dentition. So the unripened fruits, they eat those unripened foods and then they start with many complaints. Moving on to the mentals of Rheum. Mentally, we saw few points in the previous slide. What did we see in the guiding symptoms? The baby was irritable, he was peevish. So here let us see some more mental symptoms. He is very impatient and vehement, ugly and impossible to satisfy. You see, the baby is going to be very sour smelling, sweaty, all the time there's sweat on the scalp, and very kind of sour smell. So he's very ugly and impossible to satisfy the baby. He wants this and that, later becomes repugnant to the things. So he is very it's kind of very impossible to satisfy that baby. He screams, kicks, and makes himself decidedly unpleasant. So you cannot, you don't get so much of, that love towards the baby, because he's screaming, kicking, making himself, very unpleasant to look. He cries and tosses about the all night. He desires various kinds of food but cannot eat them. Becomes repugnant, as we saw earlier. He desires for many things and cries for them. He dislikes even the favorite playful things is going to dislike them. Okay, guys, this vehement are those who are very stubborn, and you cannot easily please them. Okay, they are very stubborn and very stone kids. Okay, impatient kids, and not yielding. They are very bad natured kind of thing. Moving on to the Rheum baby, it's kind of a revision. We have already dealt in the guiding symptoms and the mentals, most of the symptoms and the points. Let us revise them. The whole body of Rheum baby smells. It's a question for you guys. It smells sore. No amount of washing or the bathing can get rid of the soreness. Soreness is pervading the whole system, and the characteristic of all the discharges are also sour. The exhalations of the body are also sour. Rheum is suited to especially the babies during the dentition period. So guys, three things you have to remember. One, the smell of the body is sour, the discharges are sour, and then we see that the most of the complaints are brought during the dentition period. The child will suffer from difficult micturition due to the great weakness of the bladder. So there is weakness of the bladder, there is atonicity, there is no much pressure during the voiding. So what happens? The urine cannot pass easily. There is difficult micturiation seen in the children. He requires a great deal of pressure to expel the accumulated urine. So you see guys, he is putting on a lot of pressure. It is requiring a lot of straining here to expel the urine from the inert bladder. When do we say inert? When it is like not showing any action. So what happens basically, the pressure inside the bladder increases, and then that results in the voiding of the urine. Now the bladder is inert, there is no pressure, so there is difficult micturition. You getting it? Okay. During dentition, if stupor of the child is associated with distended abdomen. So guys, you're seeing here, it is again during the dentition period. Stupor of the child. So what is stupor? Stupor is something when there is a decreased response to the external environment. The baby is all quiet, he has no response, he doesn't know what's going on around him. The child is in a stuporous state. Okay, and it is this stuporous state where he's very unbothered about the environment. His kind of altered consciousness is there. In that state, it is associated with the distended abdomen due to accumulation of urine in the bladder. So guys, you can see the relation here, how these things are getting related. First thing, during the dentition, then comes the stuporous state. The stuporous state is associated with distended abdomen. Now, why is the abdomen distended? So this is the body and the abdomen is distended. What is leading to the distension of abdomen? It is because the bladder is inert and there is a lot of urine accumulated in this urinary bladder. Rheum is invaluable remedy in such a complaint. So we saw stupor associated with distended abdomen. Why distension? Because of urine. Mentally, Rheum baby is impatient, he is vehement, ugly, very impossible to satisfy. Short tempered, screams, kicks, makes himself unpleasant, cross and tosses about all night. Moving on to the respiratory organs, we see in rheum is indicated in cough. Cough is dry in the evening. The expectoration of the mucus is also observed. There is dyspnea on breathing deeply, as if a weight was kept on the upper part of the chest. So guys, we see here in the respiratory cough. Dry cough, there is expectoration. Moving on to the dyspnea, there is shortness of breath. The person is breathing deeply because there is a sensation as if a weight is kept on his chest. A weight is kept 5 kg. Let us simply consider like this. So a weight is kept on the chest, so he has a sensation, so the breathing is very deep in here. Moving on to the chest, what do we see in the chest? The breast complaint. What is it? The milk of the nursing woman is going to taste bitter and yellow in color. Infant will refuse to suckle the breast. Moving on to the sexual organs, the male sexual organs, we see the unusual emissions observed here. In the female sexual organs, there is bearing down pain in the uterine region while the patient is standing. So guys, we saw another complaint while standing. Can you guys recall it? What was it? It was colic while standing. Similarly, the bearing down sensation in the uterine region, you can see the uterine region here. Here in the uterine region, they feel there is a bearing down sensation. The bearing down sensation, as if everything is coming out, like there is bearing down, okay? This sensation is seen during standing. Drawing, burning in the left ovarian region. So you see in the left ovarian region we have the bearing down sensation, burning sensation, and the urinary complaints are observed after the abortion. So we are clear with the male and female. Bearing down in uterine, burning in ovary, and urinary complaints after abortion. So with this we come to an end of the remedy, a very short remedy, rheum. You have to remember the baby of the rheum, it's very important, and also few particulars, not many symptoms, not much information about the particulars found. We see more of the baby in rheum as it is indicated during dentition. So if you like my video, please hit the like button and subscribe. Thank you.